So this case concerns a male-neutered 2-year-old domestic short-haired cat weighing 3.81 kilos. The cat had a history of urinary tract disease, and the vet had requested a particular focus of the bladder on ultrasound examination. So here we have the bladder. It's this anechoic organ here. So on ultrasound, fluid appears black or anechoic, where the sound waves don't attenuate much, they don't lose much energy, aren't reflected through this fluid, and therefore the sound waves have a bit more extra energy as they reach this soft tissue beyond, so that looks a bit brighter, and that is an artifact called acoustic enhancement, which tells us that there is fluid in this anechoic area. We can also see a few loops of intestine, small intestine nearby. So this image is taken in longitudinal of the bladder, so that means we're looking from the ventral aspect up towards the dorsal spine. We have cranial towards the left and caudal towards the right in the image. So now we're fanning all the way up and then all the way down. So we get that full image in sagittal or longitudinal of the bladder. As we fan up, it continues to be anechoic fluid, but as we fan down, we can see, so we're fanning up there, down, we can see this hyperechoic content. And not only is it hyperechoic, but it also has an acoustic shadow. So there's no sound waves passing through that hyperechoic substance. Now, because there's an acoustic shadow, so we know there's no sound waves can pass through it, and we can therefore say that that is mineralized content within the bladder. We can also see a little bit of sediment floating around down there in the gravity-dependent part of the bladder. Now we're scanning in transverse, so we've got a transverse view of the colon beyond the bladder. And we're fanning through in transverse. That means we've got the left of the image is down, so that's the gravity dependent side, and the right of the image is up off the table. So here we can see that now the sediment is on this side of the image here. A bit more, we can see this sediment falling down towards the table, and we can see the acoustic shadow beneath this mineralized sediment. So now we're giving the bladder a bit of a shake, ballottement, to help move this sediment and see whether we've actually got uroliths or whether it's all sediment, and we can see it floating around. So I'm just removing the probe to get that sediment to move, and then I can see with this gravity dependent view where I'm looking down through the bladder towards the table, that the sediment is all moving around within the bladder. Here again I can see the sediment moving around inside the bladder, this mineralized sediment, giving a bit of ballottement with the ultrasound probe on the cat now to move some of that sediment. And now giving it a chance just to settle down and to check that it is falling to the gravity dependent view. So we're looking from the side of the cat that is up. The cat is in lateral recumbency. We've got the side of the cat that's up here, and then we're looking down towards the table through the bladder, and that is the gravity dependent side, and this sediment, this mineralized sediment, is settling on the gravity dependent side. Here's a still image where we can really see that we've got the anechoic bladder, this hyperechoic sediment with the acoustic shadow beneath it, which tells us that this is mineralized, that all the sound waves are being reflected, and that it's settled on this gravity dependent side. Now I'm measuring for a cystocentesis to see what length needle I will need. So I can see the needle length up here, measuring from the side of the probe that's got the marker in towards the bladder, and we can see there the length of needle that we'll require. Taking another measurement, as the measurement before had a loop of small intestine nearby, so just want to avoid that and choose a route that avoids the small intestines. And here I'm taking a cystocentesis sample. We can see the sediment within the bladder, and then we can see the hyperechoic needle down here and the tip of it, and just withdrawing some urine and then withdrawing the needle from the cat. So the foci within the bladder lumen are likely crystals. They're mineralized, they're causing an acoustic shadow. An ultrasound-guided cystocentesis was performed, and this is highly recommended when we find this in the bladder. There was no sign of uroliths, but to get an accurate diagnosis and to decide what diet might be necessary, what treatment ongoing might be necessary in this case, an ultrasound-guided cystocentesis was the required step.